Hello, everyone, and welcome to On the Safe Side, a monthly podcast hosted by the editors of Safety and Health magazine, the official magazine of the National Safety Council. This is Alan Ferguson, Associate Editor at Safety and Health, and with me, as always, are my fellow Associate Editors, Barry Bettino and Kevin Drewley. Hello there, gentlemen.
Hi, Alan.
Hey, Alan.
Thank you all for joining us for the November 2024 episode of this podcast, number 57 in our history. This episode is sponsored by SafeStart, which we'll tell you more about in a few minutes. Many of you had a unique journey into the safety profession. We want to hear more about it for our My Story feature in our magazine. Submit your personal stories about how you got into the safety field by emailing us at safehealth@nsc.org. In this month's episode, Barry will discuss what's in the November edition of Safety and Health magazine in our In This Issue segment. We'll also be joined by Eric Persaud from the National Institute of Environmental Health Sciences Worker Training Program to talk about post-disaster worker safety. And we'll get you caught up on some of the news you might have missed in What Else? Or In Case You Missed It segment. Is everybody ready? Let's go.
The November issue of Safety and Health includes some impactful stories for readers to dive into this month. We start our In This Issue segment with Alan's feature story about combustible dust. And that story opens by sharing some of the most high-profile workplace safety tragedies of the last 20 years and discusses how employers can avoid similar catastrophic events. The story explains what combustible dust is, how it's created at workplaces, what causes incidents, how to assess the dangers, and how to control combustible dust. Alan also shares 8 commonalities of combustible dust incidents based on information from the Chemical Safety Board and other safety and health organizations. Alan's story includes information on the National Fire Protection Association's current process of combining 6 of its standards related to combustible dust into one, which will be known as NFPA 660. Safety and Health's annual salary survey offers insights into the salaries of safety professionals based on a variety of different factors, including by industry, by job title, by education, and by region, plus the probability of 30 different benefits that employers offer. And you can check out a recap of our coverage from the 2024 NSC Safety Congress and Expo in Orlando, plus the latest from around the workplace safety world in this month's issue. Find our coverage in your mailbox or online at safetyandhealthmagazine.com.
For more than 25 years, SafeStart has partnered with clients to improve workers' personal safety awareness and skills. During this time, SafeStart has become a leader in human factors management, helping thousands of organizations, large and small, reduce injuries, increase engagement, and achieve sustainable culture improvement. SafeStart's unique combination of individual and system solutions gives organizations a more dynamic and reliable approach to preventing injuries and improving performance. Discover the next generation of safety management and training today by visiting safestart.com.
Disasters were front and center in the news earlier this year, with Hurricanes Helene and Milton making landfall in Florida. During that time, OSHA made a concerted effort to remind workers about the hazards of post-disaster recovery efforts. With us to talk about post-disaster worker safety is Eric Persaud, health scientist with the National Institute of Environmental Health Sciences Worker Training Program. Eric, thank you so much for joining us here on the Safe Side.
Yeah, thank you for having us.
First, as an overview, what are some major post-disaster hazards for workers?
That's a really important question, Alan, to get us started. A little context, though. Our worker training program is part of the National Institute of Environmental Health Sciences, as mentioned, and it's known as the NIHS. It is one of the institutes of the National Institutes of Health and part of the U.S. Department of Health and Human Services. So we are a federal program, and we aim to fund the development of worker safety training resources and to provide training programs for hazardous materials and waste cleanup workers, and got our start under the Superfund Amendment since 1986. And since then, have trained over 4 million workers across all 50 states and the U.S. territories. And during that time, our program has been involved in numerous disaster responses. For example, we were on the pile at 9/11, mucking and gutting houses, which I'll talk a little bit about later with Hurricane Katrina, and even recently with the COVID-19 pandemic. And we have a number of training resources for hurricanes, floods, earthquakes, chemical incidents, wildfires, infectious disease outbreaks like COVID-19 and the avian flu. And we even think more broadly about mental health and opioid prevention and so much more. And in all of them, we aim to use an all hazards approach, which is to not focus too heavily on every single possible threat, but to develop the skills and awareness to handle issues broadly, right? And that is why our trainings tend to include fundamental concerns that emerge regardless of the type of disaster. And we're talking about the simple stuff here, right? The slips, trips and falls, avoiding cuts, even simple things like how to set up a ladder, preparing for traffic incidents. And we want to raise the awareness of the environment around our workers. For example, down electrical wires and the risk of electrocution, and recognizing structural integrity might be compromised. We certainly take an elevated risk assessments when it comes to chemical exposures, making sure that workers are aware of sewage and floods, spills, how to use proper protective equipment, and to just generally try to avoid exposures altogether, not putting themselves in harm's way. And I mentioned a little bit just a moment ago about muck and gut. Muck and gut is where, following, for example, a hurricane or a flood, some homes are damaged and you need to remove some of that material from the home. And that material may include mold. And a lot of workers tend to forget that that is a possible exposure, dealing with their muck and gut, dealing with the aftermath of those situations. And we see that time and time again. And at the worker training program, we really try to aim and raise the awareness and the knowledge of our trainees so that they could recognize these kind of hazards and these threats of exposures so that they could better protect themselves, even their coworkers, their communities, and become empowered so that they could take these actions against health and safety challenges.
So what are some hazards that employers or workers may not think about?
That's a really important question to ask. You know, we always think about what you can see, and we want to make sure that workers and employers think beyond what is just physically apparent. And something that we've heard over and over again is the need for mental health training, because there is so much stress and anxiety that often accompanies workers following a disaster. And it is important for trainees, for our workers, to be able to recognize the signs and symptoms of disaster work-related stress. And they should know how to obtain support through their employers, how to go to their community for resources, and how to work to reduce stress and cope with anxiety. We, back in 2012, developed such a training, a behavioral health training for disaster-impacted communities for a wide variety of disaster-impacted workers, including those workers in disaster response and recovery and rebuilding. For example, our paid employees, our volunteers, our homeowners. And we found that through training and through some evaluations that they were able to better cope with anxiety and stress, showing that there is a pathway for training and education to help address not just physical hazards, but our mental and social hazards as well. And another occupational health and safety concern that I think a lot of employers or workers may overlook, but is getting harder to overlook now, is the need to protect workers from extreme heat. So at the worker training program, we recently created a building blocks for heat stress prevention training program, which is designed to help protect workers from heat exposures that they may face in indoor and outdoor work environments. So what comes to mind immediately might be agriculture, construction. But we also have to remember about the folks indoors.
Eric, how can agencies and municipalities and other organizations best craft effective safety plans and training programs or standard operating procedures for post-disaster activities?
the importance of partnerships and how that is a key for not just the places that we fund, but the communities they serve. It really is impossible for a single organization to take on and provide all the resources necessary to respond to a disaster. It's a disaster for a reason, and you need help. And that's why it's important to bring together the national and local agencies, the public and private entities, not just researchers, but also labor organizations and community-based programs. And by doing that, you're able to plan ahead for the next disaster. For example, one of the programs we fund, the Atlantic Center for Occupational Health and Safety Training, had partnered with the New Jersey Department of Health in response to Hurricane Sandy. And that partnership, that relationship was strengthened over the years and ended up becoming very valuable in the response to Ebola. And because they had built up that capacity, that structure organizationally to respond, they were in a better position to respond to COVID-19 because now their infectious disease programs have been built up. And it's just a constant reminder that partnerships, they are hard to build. They are hard to grow, but they are necessary to achieve the work. And by building that capacity up, you develop sustained skills. And once again, that organizational structure that is key to have the trainers necessary and the local leaders necessary so that you can prepare for disasters, not just today, but going forward.
What are some important eye, face, and head protection strategies for workers and employers?
That's a great question. I know it's very important to many of the folks in your audience. And the obvious answer is personal protective equipment, right? We want to make sure that our workers are properly trained to put on, don and doff protective equipment, knowing how to put on those crazy spacesuits and those respirators, and making sure that they have fit testing and using innovative ways to make sure that employers and trainers are able to reach workers in that education. But it's also very important to remember that protective equipment is the last line of defense. And we don't want to rely overly heavily on protective equipment and put workers at harm's way. And just to remind the audience that that includes trying to eliminate the hazard in the first place. If you can't eliminate it, try to substitute it. If you can't substitute it, try to think about engineering controls. If you need to build a wall or use some sort of ventilation, whatever the hazard may be, to try to reduce that exposure. And then, of course, looking at our administrative controls, which include worker training and education. And then when you've exhausted all means, then think about protective equipment. And those are really some important ways to protect the eyes, face, and head, but really just the worker at large.
As we wrap up today, Eric, what are some resources out there for organizations interested in improving or bolstering their post-disaster safety?
Yeah, thank you for that. And I just want to remind folks that we are a public agency and our resources are freely available. And people can go to the NIHS homepage at www.nhs.nih.gov and click on the Careers and Training tab, and then further click on the Hazmat and Safety Training tab, and it'll take you to our clearinghouse, which has a wide range of training and education resources for many of the disasters I mentioned and so much more. And it also directs you to our different components. So not only do we have a disaster preparedness program, but we also have a hazardous waste training program, a small business innovative research training program to learn about our technologies and grants. We also have a partnership with the Department of Energy, so you can learn about our nuclear waste cleanup programs. And you can look at our environmental career worker training program, which aims to provide training for people who are on or underemployed in disadvantaged communities, disadvantaged by environmental contamination and a lack of training, and learn about that program as well. You can also learn about the programs that we fund, which include not just academia, for example, Rutgers University, but also labor programs like the Teamsters and the Steelworkers for their training resources as well. And I'd further encourage folks to look throughout our institute for other resources on disaster preparedness. For example, our disaster research response program that provides training and funding for health research and response to disasters in public health.
Well, Eric, thank you so much for sharing all this great information with our audience.
And thank you so much for joining us here on the Safe Side.
Thank you for having us.
Last month, we spoke with Jamie Osborne from NIOSH on this podcast about recovery-friendly workplaces. This month, we have some troubling numbers to share via an article from safetyandhealthmagazine.com, along with a new law that could make an impact in this month's In Case You Missed It segment, a collection of headlines from our safety and health coverage. I'll get us started this month by mentioning that according to Injury Facts, which is an online source of preventable death and injury statistics compiled by the National Safety Council, 99,592 people died in 2022 from preventable drug overdoses, and that is an all-time high. In late September, California Governor Gavin Newsom signed Assembly Bill 1976 into law, which would require employers in the state to include naloxone hydrochloride or another FDA-approved opioid reversal medication to be in workplace first aid kits by December 1st, 2028. And this applies to any workplace that has employees in the state. And the bill's sponsor, who is State Assembly member Matt Haney, and he is from San Francisco, and Mr. Haney said that this law is needed to answer the increase of the synthetic opioid fentanyl from entering the state. And Haney said simply, if fentanyl continues to be more accessible than naloxone, we're going to keep seeing an increase in overdose deaths in our communities. And now this legislation was applauded by the National Safety Council for being a proactive measure to make both workplaces and communities safer. So Kevin, what's a can't miss piece of news for our listeners that you've noticed this month?
There was a recent piece of news we reported on concerning a study from researchers at Texas A&M University concerning vehicle-wildlife collisions at night. After analyzing 10 years of Texas collision data against lunar phases, the researchers found that these collisions might be almost 50% more likely to occur during a full moon versus other phases. I know we're recording around Halloween and not trying to be eerie or anything like that, but it certainly applies, not just in the so-called spooky season. Never took any astronomy classes, but the NASA website's pretty intuitive. I mean, there's full moons quite often. Whether you're driving, occupationally over the road or as part of your job or just driving at night anecdotally, it's something to bear in mind that really affects certainly workers, but everyone. One of the co-authors and a professor at Texas A&M, Dominique Lord, said that although the illumination is better, it's still nighttime. So when you drive at night, I'm not sure the illumination from the various perspectives is so much greater compared to daytime as far as the full moon goes. AAA has a few tips to help avoid any motor vehicle wildlife collisions, whether you're in a full moon or any other phase. And just before I forget, the next full moon is November 15th if you're scoring at home. But as far as these tips go, those include scan the road and the road shoulders ahead of you. Use high beam headlights if there's no oncoming traffic. If a collision is unavoidable, you can apply the brakes firmly and stay in your lane. And then also just be sure to be extra cautious at dawn and dusk and when you're traveling through areas with high and active wildlife population. Alan, how about you?
So I will look at another study. This one is from Australia, and it talks about how employers can incorporate collaborative robots or cobots in their workplace and how they kind of can ease that transition for employees by taking 3 key steps. And those are engaging workers, enhancing consultation, and it's like providing clear communication about how cobots will affect job roles and responsibilities, and including workers in the decision-making process. And for engaging workers, that's involving employees from various units in the planning and implementation stages to address concerns and gather feedback. And finally, conducting risk assessments, and that's basically developing a comprehensive risk assessment to identify and address any potential psychosocial hazards associated with cobots. And the press release from Monash University in Australia says by prioritizing worker engagement and consultation, organizations can ensure a smoother transition to collaborative robotics and safeguard employee well-being.
Well, Alan, that's a really interesting study about cobots, and I won't dive back into our previous coverage of NSC Safety Congress and Expo where Kevin was smitten with Mr. Spaghetti, the robot that is, weren't we all?
Weren't
The
we
robot
all?
that Kate Darling brought on stage. Yeah,
That, I guess, was it a robot? Like
very much
that
so.
that was
Yeah,
really lifelike. It was
yeah,
eerie.
yeah,
It
very
was very
intuitive.
eerie.
So, yeah, in a strange yet
Yeah.
cuddly kind of way too.
Yeah, exactly.
Well, do any of you know of a can't miss news story from around the safety world? We'd like to hear about it. Please email us at safehealth@nsc.org.
Well, thank you so much for joining us for this month's episode. We know your time is valuable, and we appreciate you spending some of it with us, whether you're listening at work, at home, in the car, or at the gym. A big thank you to our sponsor this month, SafeStart. You can learn more about them by visiting their website, safestart.com. We also encourage you to visit our website, safetyandhealthmagazine.com/podcasts, to check out any of our past episodes. That includes episode 18, which focuses on safety incentive programs and features an interview with transportation safety expert Brian Hammer about keeping workers safe behind the wheel. The original music for this podcast was composed by Steve Maslin. Thank you so much, Steve. And a big thank you to all of our NSC colleagues behind the scenes who helped make this podcast go. We'll be back next month to have more safety-related discussions, talk to trusted voices from around the profession, and hopefully make you smile a little. In the meantime, please stay on the safe side.